Next we have Fatima Kadar, a board member of Kadalis. Kadar Johnny. And we asked, because of time, if we could just have a minute or two on the mic. It is raining. It's a lot of rain. And there's more rain until we are filled. It's a lot of rain. Hold on.
Thank you, Komasa, great job. Komasa happens to be my niece. You're doing a great job, and a great job to the community. Youth, thank you so much. Is there anyone in the community here tonight who is in healthcare, be it a nurse practitioner, physician assistant, physical therapist? Please stand up. Please stand up, CNAs, everybody.
Stand up and be recognized.
Please stand up and be recognized, because I want us to say a big thank you to Dr. Michael Fine for all the great job the Department of Health is doing to keep us protected in this state. Thank you, Dr. Fine. Distinguished guests, friends, well-wishers, and fellow Africans. My name is Fatima Kadar. I am a nurse practitioner and board member of Kadalis Global, and it is indeed a pleasure to be here this afternoon. It is an honor to have been asked by Kadalis Global to represent their non-profit organization at this rally. For those of you who may not have heard about Kadalis, I'll take time, a very brief moment, to tell you about them. They are a 501c3 non-profit organization located at Dodge Street in Providence. Kadalis is dedicated to working with communities, children and families to alleviate poverty and social inequality worldwide. They currently have a presence in Providence and in Sierra Leone, working directly with communities to find specific and effective development solutions. Dallas Johnson and Aisha Kadar, the Science founded Kadalis in 2007, and now lead it as President and Executive Director. Aisha is my sister, and our family is from Sierra Leone, and that's why you see me dressed in green, white, and blue today, our flag. In fact, as I speak, Aisha is back in Sierra Leone as we speak, working in Kadalis' office there, which is why she could not be here to speak with you today. She would have loved to be here, I know that. I would like to thank the youth of our great community for organizing this rally for this devastating virus that is inflicting our people in the West African countries of Sierra Leone, Liberia, and Guinea. Most people will say, why now? Why is it that it is only now that we are hearing about the devastation that Ebola has caused and continues to cause to people in these three countries? These are countries where most people can barely afford a meal for a day, never mind afford health care. These are people who live in close communities and in close contact with one another. And therefore you can imagine how such a virus can spread so quickly and so widely and kill so many in a short time. For myself, Kadalis, and my fellow Africans, it does not matter what the turning point is to bring this devastation to light. What matters to us is that we all know that we need whatever help we can get at the earliest possible time frame. And we thank you in advance for whatever donation you can make. We know that we need to help our people back home to contain this virus and treat the people that have been infected, to stop them from dying in the numbers that they are currently. And this crisis is not just affecting the infected people and their families. It is hurting the entire region economically and in terms of development, because people are not able to move around. How can we move forward when everybody is paralyzed with fear? Even the World Health Organizations, UNICEF, and Doctors Without Borders are desperately appealing to the world for help. We need assistance to set up quarantine bases so patients that are correctly diagnosed are kept away so that they do not continue to expose others to this deadly virus. We need assistance to help our healthcare workers so that they can continue to protect themselves while caring for their patients. We know that they continue to put their lives at risk every time they care for infected patients without protecting themselves with the basic personal protective equipment of gloves, goggles, masks, and disposable gowns. These are things we use for granted in this country. Ladies and gentlemen, we need your help. We need assistance to help educate our people on basic infection control practices. But before we can do that, ladies and gentlemen, we need those basic supplies to enable them to practice what they are taught. We need assistance to provide disposable thermometers and other disposable medical supplies so that healthcare workers are not using those equipment from patient to patient. We need assistance with medications and to control their fevers and other symptoms. We need assistance with IV supplies and other supplies that have been passed around to you guys. Kadar is working to implement a project in Sierra Leone because we were asked what are we doing in Sierra Leone for Ebola. Please allow me to say this. If we successfully obtain a grant for funding, we will be launching an awareness campaign, training and educating community members, distributing chlorine-based soaps and creating a stronger infrastructure for dealing with future crises. It is critical that all organizations or people in the region do their part by educating family and friends. I know they are pressing me, but let me just finish my last paragraph. Finally, we would like to thank the organizations who have already stepped forward and are taking the lead while risking their lives to care for our people. Indeed, our people of Sierra Leone, Liberia, and Guinea